The nervous system, your brain, your spinal cord, and your nerves is the electronics in the body, and that's what gets things done incredibly quickly. Hi, it's Dr. Alan Lifton from Brainsplained. I was asked to talk about POTS syndrome, postural or orthostatic tachycardic syndrome. POTS is a form of autonomic dysfunction. So let me start with your autonomic function. There's a lot of stuff that's happening in your body that you're not consciously aware of, but it's being controlled by your nervous system. A lot of your brain, spinal cord, and nerve function goes unnoticed. I'm not aware of it. So I have to regulate my temperature, I have to regulate my breathing, I have to regulate my blood chemistry, I have to regulate my blood pressure, and I have to regulate my heart rate. Those things are done with the brain. They can change instantaneously in a second. The nervous system, your brain, your spinal cord, and your nerves is the electronics in the body, and that's what gets things done incredibly quickly. So if you suddenly have bad news and your heart rate skyrockets, that's happening in 1 second, and that's happening because your brain decided to send signals to your heart. In disorders of the autonomic nervous system, a variety of different things can occur. One of the syndromes of autonomic dysfunction is called POTS. And the hallmark, but certainly not the only thing, is that there's a big difference in pulse from seated or laying down to standing. And when people stand up, they get tachycardia. Tachycardia is a pulse of greater than 100, but people will feel their heart racing. Sometimes they think they're anxious because their heart is racing, but in fact, their heart's racing. It causes problems with your vasomotor control, so you're not very good at hot tubs or ice baths. It causes chronic fatigue because of impairment in carefully regulating how much blood goes to which tissues when, and also because tachycardia takes a lot of energy. So when you're tachycardic, you get a lack of energy. I don't know why, but this gets missed and it gets misdiagnosed. It's an incredibly easy diagnosis to make. You lay down, you take your pulse, you stand up, and you take your pulse again. You can do it at home. Your pulse from laying to standing should not go up more than 20 points, or if it goes over 100. So if it does that, then you have that diagnosis. Fatigue is a very annoying symptom for doctors, and when we hear fatigue, we kind of go to sleep and shut down because it's just an awful thing to get into. It's an incredibly long differential diagnosis. It's hard to get to the bottom of it. And if you're not anemic, and if you don't have low thyroid, and if you don't have sleep deprivation, it's going to be a tough thing. POTS is not generally put in the differential diagnosis of fatigue. If you have tachycardia, a lot of times people think you're anxious. A lot of times the patients think they're anxious. A lot of times they say, I'm having a panic attack. And POTS is common in younger people, and everybody thinks there's nothing wrong with them. It can be a while. It can take a couple of years before this gets sorted. A lot of the patients are on a low dose of a beta blocker. Beta blockers prevent your heart from getting too rapid, and it stops the tachycardia, or it reduces the tachycardia, and that makes people feel a lot better. These patients almost universally need to be on compression stockings because it reduces some of the fluid buildup in your legs, which reduces your total available intravascular volume, the amount of fluid available for your heart and your blood vessels to pump. Many of these patients are on sodium. I put all my patients on high salt. Typically pickles. Pickles are my favorite source of salt, although broth is just as good, and so is tomato juice. And you can use salt tablets too. Many of them are asked to do, regular cardiovascular exercise to try to improve their autonomic nervous system function. It's acquired, and it's usually immune mediated as the etiology, so people get some kind of problem from some kind of a virus, like just messes up your autonomic system. There are fancy autonomic tests that you can do for this if you want to go to a place where we have those tests, but they're not terribly required. And the treatment is pretty good. The patients do really well. It's a shame that people don't pick up on it when it's not picked up. Some people don't do well, but those people generally have somewhat of a more involved autonomic dysfunction. Maybe they actually have like orthostatic hypotension. That's where you can't maintain your blood pressure standing. It actually drops. And maybe there's something a little bit more serious going on with some of those people. But it's a good thing to treat. If you have it, it's a good thing to get diagnosed because usually most of the people do pretty well. Anyway, I hope that's Brainsplained.